Good afternoon. My name is Cindy Miller, and I'm the Executive Director at FirstLink. I have been at FirstLink for a little over 10 years. How many have heard of FirstLink? I'm hoping I see lots of hands. Thank you. FirstLink has been around since 1968, and we started as a grassroots volunteer organization that found in the Fargo-Moorhead area, Cass Clay, that there was definitely a need for a call center at certain times of the day. Your mothers were starting to work outside of the home, and kids were home by themselves. Other people with mental health concerns needed support, and so they started a call center. Back then they went from like 3 o'clock till 8 o'clock or 9 o'clock, and eventually now we're 24 hours a day, and we're across the entire state of North Dakota and Clay County, Minnesota. So we do have a 12-member volunteer board that help with policies and procedures. We have about 20 staff, and some of the different things that we do, we believe in fighting the stigma of mental health issues and suicide through the services that we provide. So we are the only call center that can answer 211 in the state of North Dakota. Currently right now, 211 is a 3-digit number that you can dial in about 94 to 95% of the United States and be able to get local resources. So it's a lifelong resource for everybody. When you leave here, and if you go to Florida, you could dial the 211 there, and you're going to be routed to the nearest call center that has resources for you. We have been doing that statewide since about 2010. Mental Health Association of North Dakota was the 211 provider originally in the state, and then we took over in 2010. We also answer the National Suicide Prevention Lifeline, so lots of times you'll see the 1-800-273-TALK number out and about, and we are the only call center that answers that in the state also. So I'll give you a little more information about that in just a minute. We also do a lot of trainings, and when Joni was talking today, I don't know how many of you have taken ASSIST, Applied Suicide Intervention Skills Training. Lots of people. Didn't a lot of what she said sound like ASSIST training? Like definitely, looking for the invitations that she was talking about, questioning, hearing their story, doing a safety plan and commitment. It felt really, she just used a little different terminology, but it definitely felt like Applied Suicide Intervention Skills Training. So if any of those of you who are here would like to, I know there's trainings across the state. I met someone at the ND Cares that does a lot in Minot, or is up in that area. But watch, they are held across the state, and it's a great 2-day training to be able to help you go through it. There's a PAL model that you go through. So it's Pathways for Assisting Life. And you go through the model and can help someone, and starting with looking for invitations or what's going on, asking the question, and kind of go through. So if you're interested in that, we do have three of us at our organization are master level trainers. We also do Safe Talk, which the North Dakota Department of Health helped get people in for that too. So it's a 3-hour training. It's just like the first part of the ASSIST model. We also have several staff that do mental health first aid and mental health first aid for those who work with youth. So if you want any other information, I know there's information on your tables, but if you would like more information about us or who we are, what we do, grab that information. You can certainly give us a call or go on our website and look up when the next trainings are going to be held. So other trainings that we do, sometimes I talked to someone yesterday from Dickinson who wants us to do just some sort of a telecom conference with them and telling people about who we are and what we do. So we can always help with that too, just to make sure that more people hear about us. As far as funding, every time we go and try to get funding, people usually throw the marketing piece out. So it's really hard to be in one part of the state and then try to make sure that everybody knows about you across the entire state. So any help that you can do with marketing or getting the information out there for us is greatly appreciated. A couple other things here that I'm going to talk about is we have a follow-up call program also that I'm going to talk to you a little more about. Here's a little more information about the 24-hour telephone services. We recently changed our inclusion-exclusion policy on 211 to include for-profit behavioral health and mental health services and addiction services. Before that, it was for nonprofit human service organizations only. But now, because of the issue that seems like we do have a concern across the state, we decided as a board to add those for-profits also. So if you are from a for-profit organization that helps with addiction or behavioral health concerns, make sure you get your information into our database so that we can make sure that we're referring people to you when someone does call from your area. We also do call forwarding lines. So Rape and Abuse Crisis Center, I know I saw Katie Fitzsimmons here again. We do after hours answering service, there she is back there, for the NDSPC, so the University Systems Counseling Centers. So if someone needs help after hours with your calls, that's another thing we do. We do them for rape and abuse, Southeast Human Service Center, the Military Family Support, quite a few different groups. So if you're looking for help with that, that's another way we can help so that your staff get a little bit of a break, and we can help you with that. So what I want to talk about right now, because we've had a lot of support with the North Dakota Department of Health, is our suicide support services. So we have a suicide follow-up call program. We also do education outreach in the schools, and we do suicide prevention trainings. I know we just had 2 staff that were just trained for sources of strength, but they have not gone through the whole piece yet, so I'm excited to hear more about that in just a moment too. And we also do a Giving Tree of Hope for the kids in the Cass and Clay communities, where we gave out about 11,000 gifts last year. So all of our helplines are free. They're all non-judgmental and give emotional support 24/7. So the difference, I know some people get confused. Should they tell someone to call 211 versus the 1-800 suicide lifeline if they're suicidal? Sometimes I think of a time when my mom had a brain aneurysm and I got home and I could not remember the code to my phone. You know, like you don't know in a crisis, are you going to remember 1-800-273-8255? I don't know if you are. So trying to get more people to enter that into their phone would be awesome. We've met with some nursing students who are going through, military does this too, trying to get people to put them in their phones. You never know when you or someone in your circle might need that information. So I really like to encourage more people to put those numbers in your phone. And then the other piece is that our call specialists are trained on the helpline and the suicide lifeline for both. They can handle calls for either. And it's really a nice mix because the suicide lifeline lots of times needs the resources that are in our 211 helpline. So it's a great, not all states have the National Suicide Prevention Lifeline and the 211 call center answered by the same organization. And I feel that's really a plus for North Dakota just because we do have the ability to give them resources if someone is feeling suicidal also. But the problem with the suicide lifeline, or not the problem with the suicide lifeline, with 211 is you can be in queue. Our average queue time when they do go in queue, and most of the time it gets answered, is 10 seconds. So it's really short, but still someone who's suicidal, we don't want them to be waiting for 10 seconds, right? So we really encourage people to use the suicide lifeline first. If we have one line currently that goes to us for the suicide lifeline, and we have one line that comes into us from Standing Rock, a suicide lifeline. But otherwise, it rolls over to the next available call center. There's 160 call centers that are in the network, and it would roll over to another available place to call. The problem with that is you might talk to someone in Florida who now, if you've just taken pills, they don't know North Dakota, they're not sure what town that is, where they're at. So it's really great, and I'm hoping that eventually we can get funding to open up another line. Our answer rate in North Dakota is I think it's about 80 now, isn't it? About 80%, and some of the states across, there's like some that are 15 to 20% of their calls they're getting answered in their own state. So I think we're doing a great job, but I think we do have the need for a second line soon, so maybe we could get it close to 100%. I will keep going here. The database that we have has we have about 5,500 resources in our database. Each entry, it's not just like 411, you just call the number and they give you an address and a phone number. We have descriptions that's going to tell what the program does, their information, their eligibility requirements, fees, office hours, is a lot of information. And so if you want to, go and check out myfirstlink.org and click on Find Resources here and look in your area. We will have a new guided search that will be coming out probably, I've been hearing this for a couple months now, but they really do think it's going to be here by March. And so that's going to have pictures instead of the taxonomy terms. So it'll have a picture of food if you're looking for food help in your community. So watch for that, but go in and look. And if your resources aren't listed in there, make sure that we know about that. Here's a list of just some of the things that are in there. You can get an idea of pretty much anything. Last year, we just finished our 2017 statistics. We had 51,351 calls. That was up 2,000 from the year before. Our calls related to suicide were 6,533, which was a significant increase. A big part of that was the suicide follow-up calls that we made in 2017. And then we only had to break confidentiality to send rescue 45 times. So you think out of all those calls, just listening, and like when Joni was saying, just being there, someone who cares, someone who's wanting to hear what's going on. And sometimes those are difficult things to listen to hear someone say all these negative things, or you think of all the things that are going on in their life. It can be difficult to hear, but you really need to stay there with them and listen to those things. So we only had to break confidentiality 45 times, which is pretty amazing. Another program, and we had a teacher in Grand Forks. I don't know if anyone's here from Grand Forks, but at Red River, one of the health teachers has their class call. So every single one of his class hours, he would have them call the National Suicide Prevention Lifeline. Lots of kids aren't used to using the phone to call someone, right? They're using texting or whatever. But he wanted them to know that it's not scary. Let's call these people. Let's see who they are. Let's talk to them. And so he puts on speakerphone so everyone can know what's kind of going on and what would happen. I thought, what a great idea. So it kind of breaks down that fear of calling. I had a call a while ago where someone was nervous to call 911. She'd already taken pills, but really didn't want to call 911, but needed to call 911. But then I got dispatched there for her. So sometimes people are nervous about something they're unsure of, and this was a great way for him to be able to open that door for his students, which I thought was pretty awesome. We are looking at starting texting in 2018. Just need a little help with some funding and training for staff. That will be interesting, just going from the kind of listening and support we're doing now to texting. It's a different game. And so making sure that our staff are trained in best practices, and we have that in place. So I just wanted to touch real quickly on the suicide follow-up call program. We have a SAMHSA grant right now that's for 3 years, so we have about a year and a half left, where there's 6 call centers across the nation that are able to, as you get discharged from emergency rooms, hospitals, public health facilities, or if you call through the National Suicide Prevention Lifeline and you are at a medium to high risk for your lethality risk is high, we will put you on the program. And so what we do is, they have found that the first 24 to 48 hours is the highest time for someone who has been discharged to reattempt. And so we make calls back to them within the first 24 hours is what we've signed up for our grant. And so we call people back within the first 24 hours and check in with them. They have the ability to opt in or opt out. They have the ability to sign up themselves. Columbia is doing a study on this to see what the return on investment is and how the outcomes are going. Callers have told them that the follow-up gives them hope, makes them feel connected and cared about, and connects them to other resources. It's voluntary, like I said. Typically, people are on the program for about 8 weeks. And sometimes some people decide no, once we call, that they're not answering. But most of the people are answering, and they're really excited about the program. Another part of the program we're doing is caring cards. And when was the last time some of you got a letter or a card for someone in the mail? Everything's online, like my daughter still, she's in her 30s, but she still sends me thank you notes, and I appreciate that. But a lot of people don't. And so it's been another best practices, and there's evidence-based that it's helping people get a handwritten card that tells them that we're thinking about them, that we care about them, we want to know how they're doing, and that's been going wonderfully too. So other people, if you want to try that with some of your clients, another great way to connect with people, make sure that they know that they count. You count. Last year we had our theme was speak up, because we wanted people to speak up about suicide. Cora and several other ladies spoke up and talked about their loss and talked about getting help. And this year our theme is You Count, because you guys do count. You guys count as people who work with others, people who are thinking of suicide, they count, their lives are important, and our donors count, and we need funding from all kinds of sources. I'm going to just mention a few here. Various North Dakota state departments, the Department of Health, Human Services, the Insurance Department, the emergency managers. We have lots of different grants and contracts, so that's pretty much who we are and what we do. Like I said, myfirstlink.org is our website, and I know my time. He just gave me the 1-minute warning about 30 seconds ago. But if you have any questions, I'm up at the front table too, so during a break if you want to stop and get more information. Otherwise, grab the information from the tables. So thank you.